All right, so it looks like we have a few viewers here, so I will just go ahead and begin since it's noon. Welcome to our Experts Live series run by the College of Arts and Sciences at UVM, featuring faculty speaking on topics related to the COVID-19 crisis. My name is Sophia Trigg, and I work in the College of Arts and Sciences Dean's Office. And today I'm happy to introduce this week's speaker, Caroline Beer, Professor of Political Science. Professor Beer teaches courses in comparative politics, Latin American politics, and global gender equality, and she specializes in Mexican politics, and her research interests include democratization, subnational politics, and gender politics. Today's talk will focus on Latin America, the Mexico-US border, and COVID-19, and will run about an hour, including questions. So if you have a question at any time, go ahead and type it into the Q&A box on your screen. Keep in mind you'll only be able to see your own questions until some are answered, so don't worry if you don't see questions popping up. We're recording this session and it will be available on our Experts Live webpage by tomorrow. So without further ado, please welcome Professor Caroline Beer.
Hello there. Thank you for joining us. And I'd like to thank the College of Arts and Sciences and Richard Watts for putting this together and inviting me to participate. And I'd also like to thank Sophia Trigg and Andy Green for making it all happen. So my talk is going to focus on COVID-19 and its consequences for Latin America. A few things I want to just say to start before we start is first that the virus arrived a few weeks later in Latin America than it did in the US or in Europe. It came to Latin America from Europe and the US. And by the time it really became an issue in Latin America, supplies were hard to come by in the international market. So in some ways, it's been harder for Latin American governments to deal with the crisis than some of the places where the crisis hit first. The United Nations Economic Commission on Latin America just released a study that suggests that the coming economic crisis will be the worst economic crisis in Latin American history. So if you know anything about Latin American history, you would know that there have been a lot of very bad economic crises in Latin American history. It's incredibly sobering to think that this coming crisis will be worse than anything we've ever seen before. And then the final point that I want to make just as a preliminary observation or piece of information is just that we remember that Latin America is a big region with a lot of different countries. All of those different countries have different governments, and all of those different governments have responded in different ways. So we see a wide diversity of responses across countries. And in particular, I want to highlight some differences between Argentina and El Salvador, who have both had very aggressive responses, contrast them to Brazil and Panama that have had a much weaker kind of lackadaisical response. In Argentina, President Fernandez ordered a total lockdown on March 20th. People can only leave their homes to buy food, cleaning supplies, and medicine. He banned all commercial flights into and out of Argentina, as well as domestic flights. He recently extended the ban until September 1st. So we can see Argentina has had a very aggressive response to the crisis, much more aggressive than most countries really in the world, certainly more aggressive than in the United States. El Salvador has also had a very aggressive response. President Bukele announced a total lockdown on March 22nd before there were any confirmed cases of COVID-19 in the country. He detains anyone who violates the lockdown order. The Supreme Court has actually ruled that it's illegal for him to detain people indefinitely for violating the lockdown order, but he has now defied the Supreme Court. So there's some real problems with sort of move into authoritarian rule by the president of El Salvador and his very aggressive response. He has very strict travel restrictions and forced quarantine for anyone coming into the country from abroad. So Argentina, El Salvador contrast really dramatically with Brazil, under President Bolsonaro. Bolsonaro has referred to COVID-19 as, quote, just a little flu. He has told Brazilians that they are resistant to it. They shouldn't worry. There are no national measures in Brazil to combat the COVID-19, although governors and mayors have ordered different kinds of quarantines and lockdowns in different parts of the country. President Bolsonaro fired his health minister because the health minister was advocating social distancing and suggested that chloroquine might not be a miracle cure. This angered Bolsonaro tremendously. Bolsonaro is an extreme right-wing populist leader. Some people call him the Trump of the tropics, and he has a tendency to sort of repeat whatever Trump is talking about at the moment. And when Trump started talking about chloroquine as being a miracle cure, Bolsonaro started to do the same thing. The medical staff at the health ministry said that it probably wasn't going to be a miracle cure, and that made Bolsonaro extraordinarily unhappy, and he fired his health minister. Bolsonaro has a lot of other problems right now as well. His Minister of Justice just resigned, accused Bolsonaro and his sons of corruption and of interfering with federal police investigations. There are widespread calls for Bolsonaro to be impeached, and some of his core supporters are calling for the military to intervene, overthrow the democratic government, and install Bolsonaro as a military dictator. So there are some troubling things happening in Brazil today, in addition to its general lack of response to the crisis. Although this picture I find interesting because as much as Bolsonaro sort of imitates Trump, we've never seen a picture of Trump or his health minister with a mask on or using sanitizers. And so I think it's interesting that there is, that he is being seen occasionally with a mask on. Mexico's López Obrador is about as different from ideologically is different from Bolsonaro as you could imagine. Whereas Bolsonaro is on the far right, Mexico's López Obrador is on the far left, but both of them have this same kind of populist tendency. They rely on personalist appeals, their personal charisma, and use their personal power to undermine and destroy democratic institutions. And they have had very similar responses to this crisis, even though they come from very different ideological positions. López Obrador continued to hold huge rallies across the country as the virus spread. He encouraged Mexicans to go to parties, to eat in restaurants, to go shopping. The health officials in the country have questioned how deadly the virus really is. There's a partial voluntary lockdown in Mexico in some parts of the country, but it's not enforced. So we see Mexico and Brazil, the two biggest countries in the region, not having much of a response at all to the crisis. An interesting kind of policy innovation that we've seen in a number of countries in Latin America are sex-based partial lockdowns. So in Peru, for example, only men can be out on the street on Monday, Wednesdays, and Fridays, and only women can be out on the street on Tuesdays, Thursdays, and Saturdays. Nobody is allowed out on the streets on Sundays. And Colombia and Panama have also instituted similar kind of sex-based lockdowns. And it's sort of an interesting policy because it makes it very easy for the police to enforce a lockdown that would limit the population on the street to just 50% of the population. It allows small businesses to stay open because the husband can run the little store, let's say Monday, Wednesday, Friday, and the wife can run it Tuesday, Thursday, Saturday. And another outcome, another possible consequence is that people think it might help to reduce domestic violence, which has been increasing dramatically in the context of lockdowns and quarantines. So if the men are all out of the house 3 days a week and the women are out of the house the other 3 days a week, it potentially might keep some of these domestic conflicts from becoming violent. Ecuador and Panama have the highest death rates in the region so far. Guayaquil, which is the largest city in Ecuador, seems to have the highest death rate as a city so far. The story in Ecuador seems to be that a lot of wealthy families send their children to Spain to go to school. And when the crisis broke in Spain, the children came home and the disease spread from there. Panama, of course, is kind of crossroads of the world, and so the places that have the most interaction with the world are the ones that have been most hard hit, at least in the first round. This is a table I just pulled from the Institute for Latin American Studies at Columbia University. They have a great webpage with lots of really interesting articles and webinars. But this last column right here shows the death rate as a proportion of the total population, so the death rate per million inhabitants. And you can see really dramatic variety across the countries in the Americas. The United States, of course, has the very highest death rate, 160. This is as of 2 days ago. The death rate in the United States was 166 people per million, 70 per million in Canada. And then the highest rate in Latin America so far, again, Latin America is a little bit behind us and probably has not reached its peak yet. But Panama has 39 deaths and Ecuador 33. And then Costa Rica, as low as 1 per million. There's a lot of diversity in the response and the outcome of COVID-19 across Latin America. That's just sort of the main point that I wanted to make right there. There are 3 main issues in contemporary Latin America today that I think we want to think about when we think about the effects of COVID-19. First is inequality and poverty, second, crime and violence, and third, migration. So I want to talk about each of these 3 topics. In terms of poverty and inequality, a few things that I think we should be thinking about is the cramped living conditions in poor neighborhoods that make social distancing impossible and make quarantines and lockdowns very difficult. So in poor neighborhoods, you'll have large extended families living in sometimes 1 or 2 bedroom houses, making it obviously impossible to social distance, but also very, very difficult for people to stay in lockdown for weeks at a time. The healthcare systems in most of these countries are very poorly financed and under-resourced, and they have already been overloaded by the healthcare needs of people with COVID-19. And also, Latin American countries have large informal sectors that is related to the poverty and inequality and has, I think, a really important impact for understanding COVID-19. The informal sector in Latin America employs almost 50% of the workers in Latin America. It varies from country to country. It's as low as 30% in Costa Rica and as high as 75% in Guatemala, but is big and important in all of Latin America. The informal sector is the part of the economy that is not taxed or regulated by the government. It's made up of domestic workers, meaning like housekeepers and gardeners, and people like that, street vendors, and all sorts of little micro businesses. So a woman might have a sewing machine in her living room and do alterations and take orders from her neighbors as a kind of a micro. That's what kind of thing that I mean by a micro business. These people make up half of the workforce in Latin America. These informal workers have no labor protections. If they don't work, they don't have money to buy food. And so the only way that you can make a lockdown work is to provide food for these people, for the government to provide food for these people, or some sort of cash assistance. And we see some countries, Colombia is providing door-to-door food boxes in poor neighborhoods. Peru has provided a cash transfer, $60 a month per family, to buy food during the crisis. So those countries have had more luck in keeping people locked down than places that have not provided any kind of assistance to informal workers. The prevalence of domestic work in Latin America, that is, housekeepers and maid servants, is a really important vector for the transmission of the virus. 8% of all women in the region work as domestic workers. It's the largest source of employment for women in the region. So a lot of people work as domestic workers. It's not too much of an exaggeration to say of Latin America that you either are a maid or you have a maid. And that's a consequence of the intense inequality in Latin America. And what seems to have happened is that the wealthy have traveled abroad to Europe, to the United States. They got the virus, they came home, they spread it to their housekeepers, but then didn't spread it too much beyond that in the wealthy communities, because they live in big houses and they've been able to isolate and keep themselves away from sick people. But the housekeepers then go home to the shanty towns where there's overcrowding, and lack of health care, and it spreads like wildfire through the poor neighborhoods. The looming economic crisis in the world and in Latin America will dramatically exacerbate pre-existing problems with poverty and inequality. The poor will be the hardest hit economically and also the hardest hit in terms of health. Economists estimate that GDP will decline by at least 5% this year across the region. Things look even worse in Mexico. GDP decline could be as high as 10%, according to some economists at the UN Economic Commission for Latin America, and they are estimating that as many as 22 million people will fall out of the middle class and into poverty in Mexico alone, not including the rest of the region, because of the economic crisis. Crime and violence is also a big issue in Latin America. The quarantines and the lockdowns have led to a pretty substantial drop in street crime across Latin America. Homicides are down, robberies are down, but there has been a dramatic increase in domestic violence. Reports are way up by 50% in Rio, 60% more calls to domestic violence hotlines in Buenos Aires. So the small data that we have so far suggests that while street crime is down, domestic violence is up a lot. Drug trafficking has dropped off quite dramatically, like all businesses. It's kind of ground to a halt. In some areas, we do see some increase in extortion of local businesses as drug trafficking organizations try to make up their lack of cash with the drug trafficking. With the drug trafficking ground to a halt. We also see, interestingly, organized crime groups distributing goods and services, enforcing quarantines and curfews, offering high interest loans to people out of work, and so providing some services, which isn't terribly unusual. I think we see organized crime groups doing that in lots of different places. And the final thing that I just want to mention is that prison overcrowding is a terrible problem in Latin America and is likely to cause widespread transmission of COVID-19 in the region. This is a picture that has been really widely in the press. This is El Chapo's daughter, and she has been distributing face masks with El Chapo's photo or his image on it, and these food boxes across Guadalajara to poor people, mostly to elderly people, with, again, El Chapo's face on it. And you can see on the box it says elchapoguzman.com. And this is pretty typical of things that the Sinaloa cartel does. We see other examples in the favelas in Rio, for example. There's been reports of the drug gangs enforcing quarantines and lockdowns. And so some of the organized crime networks are providing some services to the population, mostly to populations that have been abandoned by the government in areas where there's a lot of organized crime. These photos were distributed in the last few days by the president of El Salvador to show everyone how hard he is on prisoners. And so these have all been taken in the last few days in El Salvador's prisons. You can see while the men all have masks on, there's not a lot of social distancing happening in the prison system in El Salvador, and so it's likely that these prisons and other prisons across the region are going to become hotspots for spread of the virus. The last topic I want to talk about is migration. Undocumented migration has dropped dramatically since March. Borders are closed across Central America. Most Central American countries are under lockdown. Public transportation systems are shut down, so it's very hard for people to migrate. But we should not forget about the Remain in Mexico policy that was implemented by the Trump administration last summer. As a result of the Remain in Mexico policy, 60,000 non-Mexican asylum seekers. These are asylum seekers are people, not illegal immigrants, they're people who come to the US border and claim that they are fleeing for their lives, and their lives are at risk if they are to be sent home, and ask for asylum in the United States. This is a perfectly legal thing to do. And traditionally, people who sought asylum were allowed to stay in the United States until their cases could be heard. But starting last summer, the Trump administration started sending these people to Mexico. These are not Mexicans. They are people coming from other countries seeking asylum. 60,000 have been sent back to Mexico, and they are living in large refugee camps at the US border in Mexico. This is a humanitarian crisis, particularly now in the context of a global pandemic. Other issues related to migration that I think are important is that the U.S. has been deporting large numbers of people back to Central America, and many of them have been infected with the virus, and that seems to be the main way that the virus has traveled to Central American countries. Guatemala is no longer accepting any U.S. flights of any deported people because so many of the deportees have tested positive for COVID-19. And a final piece of the migration issue in Latin America as a whole is the crisis in Venezuela that has led to 4 million Venezuelan refugees across the region. Most of them are living in the states that border Venezuela, Colombia, Ecuador, Brazil. But most of these people have no access to public health systems. Many of them don't have places to live. And so this is really aggravating the COVID-19 crisis across the region. These are some photos of the border, these refugee camps at the U.S.-Mexican border, where these 60,000 non-Mexicans are living, being hosted by the Mexican government. The UN Commission for Refugees is also helping to support some of these camps. But you can see people are living in very close quarters in kind of makeshift tents. You can see right here that they are collecting wood to cook on. They don't have any other way to cook, so here there is an open fire that they're cooking on. There's no running water in these camps, so people can't be washing their hands and social distancing in the ways that we would recommend in the context of this global pandemic. In this picture, you can see how closely people are living in these camps. This is back here, you can see the US border wall, so this is the US back here. There's no running water, there's a handful of porta potties here. This is a real humanitarian crisis, and the COVID-19 is going to have a terrible impact on these communities that are living in these refugee camps along the U.S. border, and it's going to be they're going to become hotspots of the virus, and it's going to be impossible to contain the virus, and it's going to travel outside of these communities as well. And so I guess I just want to conclude by saying what I see as the lessons of this global pandemic, looking at it from the perspective of comparative politics. First of all, diseases travel. Walls do not keep out disease. We are all vulnerable, and the best way to keep everyone healthy is to improve the health of the poorest people in the poorest countries, because that's where the diseases start, and they're going to inevitably come and travel to us. It is in our own self-interest to invest in healthcare for everyone. So I think that I was asked to talk for 20 minutes. That's been 20 minutes, and so now I will take some questions. Sorry, I'm looking for the right place where all of my questions are. Let's see. Not seeing the questions. Sophia, could you help me figure out where the questions are going to be? Oh, wait, there we go. There we go.
There they are. Yep, one's in now.
Okay. What specifically is happening in Guatemala with COVID-19? So I don't have a lot. I know that most of the cases so far in Guatemala have been brought in by people deported from the United States, so Guatemalans that were deported from the United States, and Guatemala has stopped all flights from the United States into Guatemala. Beyond that, I don't have, I don't know a lot specifically about what else is going on in Guatemala. Richard says, do I think this is going to undercut regimes who have done nothing like Brazil? Yeah, I mean, I think Bolsonaro has, I think both, so the two countries that have really done very little are Mexico and Brazil. And I think that both of those presidents are, both of those presidents are having a lot of problems. Their approval ratings are dropping. Bolsonaro is having, is in very serious very serious problems right now. Even many of his supporters have abandoned him, including his minister of his legal advisor. I can't remember his name right now, but and in Mexico as well, López Obrador is having increasing problems. His popularity ratings are going down. So yeah, I think that they are going to suffer. Both of them are going to suffer. There's another question here from Liz Fenton. I'm curious about how the virus is affecting migration within Mexico, say from places like Oaxaca and to Mexico City. But most of the public transportation is closed or dramatically restricted, so there's not a lot of movement within the countries. The really strict lockdowns are more in Central America than in Mexico, but still public transportation isn't up and running at the same rates that it usually is, and so there's not a lot of movement within countries. So even the movement from the south of Mexico to Mexico City is also mostly shut down. Another question, is there widespread testing? No, and so I would be really suspicious. I put that data table up of how many people have died of COVID in each country, but I'd be pretty suspicious about what those numbers really mean, because I think a lot of people are dying and are not being tested, and so they're not being counted as COVID-19 deaths. There isn't this, I mean, we're having trouble testing people in the United States, and we are an extraordinarily wealthy country. These are poor countries. They don't have access to anything like the kind of resources we have access to. They're not testing nearly enough people. And so I'm sure that the death rates are a lot higher than what we think they are. So here's a question about Daniel Ortega. Could you talk about Daniel Ortega in Nicaragua and his response? He seems to be following Bolsonaro's lead. Yeah, absolutely. And it does seem that there's a sort of separation between the real populists, those who don't sort of respect institutions and expertise in science, and that includes both the populists on the left and the populists on the right. So Daniel Ortega we usually think of as being on the left, along with López Obrador and Bolsonaro. And Daniel Ortega has said that it's not a problem for Nicaragua. There have been sports events. Some of the only sports events in the world going on right now are in Nicaragua. There has been recently, in the last few days in Nicaragua, there's been sort of more of a effort to quarantine and lockdown, but for many weeks, big sporting events with full audiences were going on in Nicaragua. Interestingly, though, Daniel Ortega has been nowhere to be seen anywhere publicly. So while he's suggesting Nicaraguans go out in public, he hasn't been doing that. But yeah, I would put Nicaragua in that same category with Mexico and Bolsonaro. Lisa asks, can you speak to whether people in some of the countries you spoke about are following orders set by the government? Are you aware of examples of groups openly violating social distancing orders? I think this varies really a lot from country to country. So in Mexico, there's been pretty much no enforcement at all, and so people are out and about in lots of places. In Argentina, I think it has been quite well enforced. Colombia has a $240 fine if you're out on the street when it's not your day. They have the sex-based quarantine. And then, in El Salvador, they have just been detaining people basically in prison if they find you out on the street when you're not supposed to be. So really dramatic differences in the level of enforcement and people's respect. But the places where it's hardest to enforce and people are least likely to respect it are in the poor neighborhoods, because people simply don't have food to eat if they don't go out to work. A question from Donovan. What industry has specifically been hit hard by COVID-19 in Latin America? Well, I think all industries have been hit really hard. I'm not sure there's anything, pretty much all businesses are being shut down. The people obviously who suffer the most are people that have the least amount of money and reserves, and people who can't work from home. So more educated professionals can continue to do their jobs. But I think all industries are being pretty hard hit across the region. Another question, as we've seen in the US, federal response differs from regional and states. Do you see regions, governors, mayors respond that dramatically different from their federal governments? Yes, we have seen that, particularly in the federal countries. The major federal countries in Latin America, so these are countries where you have states that have autonomy in the same way that we do in the United States, are Argentina, Brazil, and Mexico. In Argentina, there's been a very strong federal response, and everyone has fallen in line with that. But in Brazil and Mexico, we've seen they actually mirror the United States much more, where there's a weak or non-existent federal response, and then different states have had different levels of responses. So the mayor of Rio and the mayor of Sao Paulo, for example, have had very strict lockdowns. The mayor of Mexico City also has imposed a fairly strict lockdown. So the mayors of the big cities are often being much more aggressive. And so we see very different kinds of responses across the countries, particularly in Mexico and Brazil, not as much in Argentina, which is also a federal country. And then the other countries aren't federal, and so you don't have subnational governments that have quite as much power, but we do see some mayors doing different things, and obviously the spread is going to be much worse in urban areas where people live very close together than it is in rural areas. Jane Henley asks what the situation in Nicaragua. I just talked about that Daniel Ortega would put him together with Brazil and Mexico in terms of not taking this very seriously. In fact, I think Daniel Ortega probably has taken it even less seriously than Bolsonaro or Ortega. And so we'll wait and see what happens in Nicaragua. Long term, do you see the countries that do the best emerging as more leaders? Does it change the balance of power? The balance of power in Latin America probably doesn't change too much. Because the dominant power is, and always or will be for the long term, is the United States. Very asymmetrical relationship between the United States and the countries of Latin America. But then within Latin America, Mexico and Brazil are so much bigger and so much more powerful than other countries that it's hard to imagine that, even though, the one place, the really big contrast between Argentina and Brazil, where Argentina, I think, is taking the crisis very seriously, and probably is going to forestall real catastrophic problems, whereas I can imagine there being real catastrophe in Brazil. So we might see in South America, Argentina emerge somewhat more as a leader, and Brazil's power constrained. I think Brazil also is going to be, its international power is going to be constrained by serious, the serious political problems that are brewing under Bolsonaro, which are aggravated by COVID-19, but not caused by COVID-19. There's a question here about Cuba, and I just have to say, honestly, I'm not really sure what's going on in Cuba. That's not something I looked into, so I'm just gonna pass on that question, I'm sorry. Could this crisis lead to a right turn in Mexico again, since AMLO isn't doing much to solve this? Perhaps a return to the PRI. Yeah, I think that there's a good chance that AMLO started a new party. AMLO, Lopez Obrador, is the president of Mexico, and he started a new party, a sort of leftist party, but allies with evangelical Christians that are far right. So kind of a strange populist party. And I think that it's hard to say who could follow him and win the next presidential elections. Of course, that's quite a few years off. But I would think the PRI or the PAN, would be the obvious. Probably the PAN might be the most obvious beneficiary of this, because they're kind of known as good clean government, competent technocrats. So if this really, if the economy really falls apart and and there is terrible healthcare outcomes, I think the PON might be the biggest beneficiary. Emily asks, besides sex-specific lockdown restrictions, are governments thinking about how to address this increase in domestic violence during the closures? We see in Argentina and in Costa Rica, there have been some efforts, both by NGOs and the government, to come up with ideas to help deal with the really dramatic increase in domestic violence. Argentina has a hotline where you can call, and there's sort of a secret code that you can give, and then the police will come to your house. And in Costa Rica, there's a Twitter movement to sort of send out messages if women need help. But of course, you have to have access to Twitter for that to work. So there's been some sort of social media attempts to come up with ideas, but I don't think there has been a really, any really great breakthroughs in trying to solve this problem. Why is it not uncommon for organized crime groups to distribute goods? So organized crime groups anywhere, in any country, but in Latin America in particular, need the support of the local population where they work. They need the support. They need those people to, at the least, not go to the police and tell them what's going on and act as witnesses. But they also probably want support from the local population. Organized crime groups tend to be most powerful in parts of the country where the government has kind of abandoned the population that live there and don't provide any government services. And so organized crime groups will often step in and work as kind of a pseudo-government. They tax the population by extorting local businesses, and they use some of their profits to provide services to the local community. You see that pretty, you see that pretty consistently. It seems like the organized crime groups that have the stronger their monopoly over a population, the more likely they are to kind of act as a government, to tax through extortion and provide goods and services. And then where there are weaker organized crime groups that are in competition with each other and fighting for each other, then they tend to spend less time and less money doing that, and they have less resources to do that. In the case of El Chapo's daughter giving out all of this food, it was a really well orchestrated sort of PR event. Her people were taking pictures. You can't take pictures of leaders of drug cartels unless they want you to. Her people were taking these pictures and videos and distributing them. And so it's part of a big propaganda effort to gain support of the local community. So yeah, it's not an uncommon thing to see organized crime do that kind of thing. What are the best sources of information for Latin America? And also what's happening on our southern border. Okay, so best sources of information. As I said, the Institute for Latin American Studies at Columbia University has a great webpage with a lot of really important and good information about COVID-19 and a lot of data. The Harvard University Global Policy Tracker also has a lot of good data tracking all the policies of every country in the world. In terms of news sources, I think the Wall Street Journal and the New York Times both have pretty strong Latin America pages in terms of news available in English. So those would be, and the Washington Post often has good news about Latin America as well. So those would be some of the places that I go for sources in English. What was the other question? I just published it and now I forgot. Let me go back and see if I can see. Oh, what's happening on our southern border? Well, so there's very little undocumented migrants coming across Mexico from Central America trying to get into the United States right now. So the new migrants are, in the last month, have basically, disappeared. They're staying at home. They can't, local buses aren't running. They can't get from Central America up to the U.S. border. So that sort of part of the crisis has kind of ceased to be a problem temporarily, right? It's really just temporary. And Trump's executive order of no more immigration hasn't had much of a practical effect because so few people are traveling and migrating. I think but what it has done and what it will do is just like gum up the system all the more to make the people that do have a legal right to immigrate to this country wait longer. It'll be harder for them to get their papers. It seems, from what I understand, the executive order that Trump made is it doesn't affect anyone already in the country, and it doesn't affect anyone who is married to a U.S. citizen, but the people that are going to be hardest hurt are people looking to get permission to come to the United States who are married to a green card holder, and it's probably going to increase the amount of time. Those people often have to wait 5 to 10 years outside the country before they can come in with a visa, and it's probably going to just increase that by another few years. And then the board, and then all of these asylum seekers, non-Mexican asylum seekers that are in these refugee camps, continue to be there and are suffering. And I think those are going to become COVID-19 hotspots for sure. Okay, so I have another question about what the response of organized crime. So I talked about a few things that I think organized crime. First of all, drug trafficking has, really diminished. Some of the bigger drug trafficking organizations that have a lot of resources are just kind of taking a break and/or distributing goods to people in their kind of sphere of influence, the populations in the areas where they work. Some of the smaller organizations that are sort of at risk of extinction because of the economic crisis have really ramped up extortion of local businesses. So it really, your relationship with the organized crime depends really where you're living and what organizations are dominant and what this sort of situation is. So there are places where the typical extortion, so a lot of the organized crime sort of goes door to door to local businesses and forces them to pay protection. In some places, the organized crime networks have stopped that extortion. In other places, the extortion seems to have gotten worse because they can't sell drugs anymore, and so they have to make up the losses with that. And as I said, some organizations are distributing goods and services to people. Others are in both El Salvador and Brazil. There have been lots of reports of organized crime networks working to enforce curfews and lockdowns. Of course, it's good for their business. If everyone's sick in the neighborhoods where they work, it's going to be even harder for them to work. So just like legitimate businesses want to support the lockdown for the long-term health of the economy, I think sometimes the drug trafficking organizations are doing the same thing. Given many countries' lack of healthcare system that can do widespread testing, especially among the lower classes, do you think this virus will circulate around Latin America longer than other countries such as the United States? I don't know. I'm not an epidemiologist. I'm not exactly sure. I mean, I was just reading an article about Sweden that doesn't have any kind of lockdown, and they've 10 times as many deaths as Denmark or Norway on the one hand, but then the health minister is saying, well, they're building up this herd immunity, and now they think 30% of the population has already had it, and so the crisis will pass faster. I don't know. I think we'll just have to. That's not my epidemiology. Is not my expertise. So I'm not sure. Will this crisis lead to worse economic collapse in Mexico than the oil crisis in the 1980s? That's what ECLAC is saying, the Economic Commission for Latin America. It says that that this will be the worst economic crisis ever seen in Latin America. which would mean worse than the oil debt crisis in the 1980s, which is pretty horrifying, really, to imagine a crisis that's worse than that. 5%. The estimates I've seen is that GDP will decrease across the region by about 5%, but worse in Mexico, because, you know, López Obrador has really invested heavily in the oil industry, and his whole plan for Mexico was that they were going to save the Mexican economy with oil, and oil, as we know, has become, has dived into negative prices because there's so much extra supply. There's nowhere to store it, that people are actually having to pay people to take it. And so that's going to really be devastating. I mean, Mexico's economy relies on oil, tourism, and remittances from the United States, and all of those sources of income have been really heavily hit by the COVID-19 crisis. Trish O'Kane asks what Spanish language sources of news I read. I read mostly Mexican newspapers, because that's what I really focus on, is Mexico. I think the best news source in Mexico is El Proceso, which is a weekly news magazine. I also read La Jornada and the Diario. I read most of the major daily Mexico City newspapers, but I think the very best news tends to come from Proceso. I also listen to the Aristegui newscast on Facebook. It's a live broadcast. What is the situation in Haiti and the Dominican Republic? I have to say that I can't give you any real details on those two countries. I'm sorry. All right, that looks like all of the questions, and we're almost out of time anyway. So thank you very much.
Wonderful. Thank you so much. Just going to mute you there. All right. Thank you so much for coming and doing this for us. We really appreciate your expertise on this topic. Next week, for everyone watching, we are hosting Leslie Ann Dupini-Giroux from the Department of Geography, and she's also the Vermont climatologist. She'll be speaking on weather, climate, and COVID-19. This talk will be available on our website there at the bottom of your screen. Should be up by tomorrow. We post them on YouTube, and we also provide the transcript. So if you need that, that will be available. Until then, we'll see you next week, same time. Check that website there again for the link to next week's talk. Thank you very much, and we hope you have a good day.